Northern Acquired Brain Injury Forum is a forum of people who work within brain injury, and that can be solicitors, it can also be case managers, clinicians, therapists, nurses, doctors, social workers, the whole realm of professionals working in this area. But it's also a safe space for them to actually discuss individual cases, because brain injury is so complex. It's always a case of always learning, and these forums and the conference today is all about continuing that educational journey and learning new things all the time.
NR Times recently attended the Northern Acquired Brain Injury Forum at St James's Park. Whilst there, we spoke with members of NABIF, Paul Brown and Alastair White. Here they both are to give an introduction of themselves and their careers.
I'm Paul Brown. I'm a solicitor with Burnett Solicitors in Newcastle, but I'm also the Secretary of the Northern Acquired Brain Injury Forum and the UK Acquired Brain Injury Forum, and Chair of Headway Wayside.
So my name is Alastair White. I'm the Chairman of the Northern Acquired Brain Injury Forum, and I'm also the Business Development Manager for Inspire Neurocare. And I've been working in the brain injury field as such for the last 17, 18 years.
We asked Paul and Alastair for their views on current issues in the field of brain injury and the ABI strategy.
So generally, in terms of accessing services, there's a differential. There's a postcode lottery still across not only the northeast but also across the country in terms of accessing particularly community-based rehabilitation services for brain injury, and that's really where the key is in terms of those outcomes. So a lot of work is put into saving somebody's life in the acute side in terms of hospitals, but then moving on to rehabilitation. But then once somebody's discharged into the community, then often a lot of those gains are lost if community rehabilitation isn't kept up. And unfortunately, in terms of community-based rehabilitation in particular, that is still underfunded at the present moment in time. There's pockets of fantastic services like Northumberland Henry Service or the Community Acquired Brain Injury Service that covers Gateshead, South Tyneside and Sunderland, but unfortunately it's not across the country, and that's something that hopefully the ABI strategy, which we're working with parliamentarians like Liz Twist MP and like Chris Bryant MP to try and address that and make sure across the country that people get access, a right to rehab across the country.
So the pockets of excellence in the brain injury field are few and far between around the country, and here in the northeast, for example, we've got fantastic trauma centre, we've got the Walkergate Park Neuro Rehabilitation Centre, which is absolutely fantastic. We've got the community ABI service covering Gateshead and Sunderland. After that, we have very, very little, and the work of the charitable sector in the region has been absolutely fantastic, filling in those gaps. However, around the country that's not always the case, and sometimes it's left to the charitable sector to pick up this work. So and that in itself creates a challenge with regards to funding, available people, willing volunteers. So we get a lot of volunteers from the legal side of things, we're relying upon them, brain injury case management and family members of people affected by brain injury, so we're kind of reliant upon that. So for us in the neuro rehab field, in the brain injury field itself, we obviously through organisations such as UKABIF and local or regional ABIFs, we try to highlight the gaps that are in the local regions, but also try to address that with providing services, whether voluntary or funded through statutory funds or even through private companies. So I would say in the last 17, 18 years there has been advancements made. The work of the all-party parliamentary group on acquired brain injury is trying to address that at a governmental level and passing that information down, working in between with different governmental departments, that is starting to have a trickle-down effect. Needs to happen quicker. Unfortunately, it's not a level playing field, and if somebody falls down the stairs, there's no blame. We're left at the mercy. Mercy may be a strong word, but we're left at what services can be provided locally. Sometimes, I say in the main, they're very generic, not necessarily neurorehabilitation specific. There's an absolute void there. So for us, it's highlighting those gaps, trying to address those gaps, trying to influence decision makers, and also using bodies such as the All-Party Parliamentary Group, trying to influence change. So it's still ongoing, it's taken time. It is slightly different from 17, 18 years ago. We're starting to get there, and long way may continue.
So in terms of access to community rehabilitation, we want to make sure that everybody with a brain injury is able to access a community-based service. That means that they can refer into that service themselves. They're not going through their GP to do that. They've had a diagnosis, they've got confirmation of a brain injury. They can then go back into that service as and when they need it, because there might be life events that they need additional support during their lifetime. And it's important that they're not facing those barriers, and we're not putting more pressure on primary care in order to access these services in the long term.
So for the charitable field, stepping in to fill in gaps, a lot of the issues are about funding and addressing those gaps. Now, is that right? And when we look at the regional differences, some statutory authorities recognise the gaps and will try and plug them with limited funding. Of course, the cost of living is increasing, so that has a knock-on effect with actual services that can be funded. So the financial constraints that are there for funding for these charitable groups, regional charitable groups, is getting squished. It's one of the first things that goes when money is tight, is money for charitable services. Training is another one that goes quite quickly. But for charitable sector, and it's not just the brain injury field, it will also be any charitable service that's being delivered in the community that will be affected. So it's a challenge for local charities. And then the brain injury field, obviously it's a hidden disability. It's not cute, it's not sexy, we're not dealing with children, we're not dealing with animals, we're dealing with sort of like adults in a very hidden disability. And it can be quite fine, but also can be quite difficult in getting people's understanding of what, or society's understanding of what people are facing when they have a brain injury and what their family have got to go through. That still needs to be addressed, and raising the profile of such issues as one of the parts of local acquired brain injury forums. I'm obviously chairman of the Northern Acquired Brain Injury Forum, and this is one of the things that we try to address, and by raising that profile and assisting of the charitable bodies as to raising their profile and the issues that they face.
Well, since the All-Party Parliamentary Group for Acquired Brain Injury was launched back in 2017, I've seen a huge difference in the amount of times that brain injury has just been mentioned in Parliament. That wasn't the case beforehand. Obviously, the amount of mentions in Hansard has increased substantially over time, and that again has been because of the driving force of the likes of Chris Bryant, likes of Liz Twist, who have pushed this in Parliament. But it's, again, in terms of the ABI strategy and also the previous Time for Change report, which we launched in 2018, it's about putting it into action now. And we need to have funding to be attached to the ABI strategy to make sure that it does happen in the longer term.
So for the ABI strategy that's been set out with UCABIF and supported by the All-Party Parliamentary Group on ABI, how do we get that into play? I think we influence, obviously we have to promote that as much as possible, and to get traction on that, it's getting members of Parliament on board, dealing with NHS England, looking at the rehab prescription, the nice guidelines that are there. These have all come to the fore, and they're getting presented. The rehab prescription, for example, just wasn't on the radar 10 years ago, from what I understand. Now that's there, and that's been adhered to and spoken about in litigation cases and case management. That's something that's really highlighting the issues that people with brain injury face and what should be in place. So influence on that and raising that profile is one of the ways that the ABI strategy can come onto people's radar. Those decision makers, certainly within the NHS, but it's also the local authority, having them to be aware of what this strategy actually gives people with brain injury and their families an opportunity to live a better life and become more independent and not reliant upon the state as much as they are now. And I think the gaps are slowly but surely being addressed. Will take a lot of time, but there is traction with this strategy being in place.
As a solicitor, we asked Paul for his thoughts on how the role of a solicitor has changed in brain injury cases in recent years.
Yeah, so I mean, in terms of the role of litigation, there's an important role for litigation, so that you know, if somebody does have a legal claim, they're able to access a specialist brain injury solicitor. There are accreditations such as Association of Personal Injury Lawyers, brain injury accreditation, which is an important part of that, to make sure that the people that are dealing with these cases, which are very often very complex, have got the experience and obviously continue to learn and develop their skills in terms of supporting patients and families going through the process. But it's obviously trying to access those interim payments, make sure that the person makes the best possible recovery that they can. That's the most important thing for any family going through the process, is to make sure that their loved one will make the best possible recovery. Ultimately, that's our primary job. The rehabilitation should always come first. The litigation should follow behind that. And that's what we always try and do, certainly at Burnett.